Yes, my friends, today is the weekend here, and we are going through first a topic that we did not uh, think we will cover, but it's important to cover this topic and we learn some one, two, three things. Hmm? Today we're gonna cover something called pain. We're gonna cover something called pain, and you see, pain is an unpleasant substance in your body, maybe emotional or physical. Physical pain. You know physical pain. Everybody understands what physical pain is. You've been Doreen Small. Good morning, Doreen Small. Good morning, Doreen Small. I know where you are right now. It's morning hours, and it's good we learn. We talk about pain. Pain is something that shows that there is something wrong in your body. And there are several types of pain that we should look at. One of the type of pain that we should look at is physical pain. When you are cut, you are hit by something, or there is something going on in your body, there is inflammation, and you start feeling pain. You start feeling pain. That is one type of pain. But there is the other type of pain that is called emotional pain, mental adherence, emotional pain. And these things can happen during injury, illness, potential harm. You are sensing something might happen and you become nervous. And what it's only always a warning signal that sometimes maybe something may be wrong. Hmm? Acute pain. Acute pain may start suddenly, but there is another pain which is called chronic pain, lasts for long time because there's something that is making you feel pain is still in your body. So lasts for a long time, like 3 months. That is chronic. But sudden pain is called acute pain, usually due to injury, inflammation, and sometimes infections. You've had a boil. A boil is something that causes a lot of inflammation because you have something called Streptococcus pyogenes, which is causing inflammation and sepsis. That one is you will feel some pain always. And now we study and look at what is pain. What other We have several types of pain, eh? And some signs that we feel, and we think that these signs are a reason why I'm feeling pain. Let's talk about pain first. Why pain happens is this: the nerve endings, the pain receptors, detect damage of some danger or some danger sign. So you start feeling pain. Now, let's see in your body first things that happens because before you feel pain. There are some strange things that happens to your body that at times you may go ignore. Ah, uncle is in the house. Welcome, uncle. Today we are talking about pain and strange body signs you should never ignore. There are some things that you should never ignore when it comes to your body. One is shaky hands. You've just you're just okay, and then you at times acutely you start shaking your hands, shaky hands. A minute. Welcome Doreen Small, welcome Dominican Uncle to the platform. Today we are talking of pain and signs and symptoms. So let's talk about hands that shake, shaky hands, and then you get pain. You see, shaky hands might be a sign of anxiety or stress. Some people, when they are stressed, they get shaky hands. But you are just healthy, and then all of a sudden, gradually, you start having shaky hands. You know, this might be as a result of low blood sugar. Happens when your sugar levels go down. May cause sweaty dizziness, hunger, or weakness, and then you start feeling headache. You see, headache is pain. Too much caffeine drinking is a problem. I usually tell people sometimes caffeine may cause tremors because they bind into your nervous receptors, nerves. You get it? We have fatigue or lack of sleep. Body may respond with some shakiness. You see, but some conditions like this is a sign. I'm giving you a sign. One, I've started by your hands shaking, your hands shaking, your hands shaking may be a sign of these things that I'm speaking. And it's essential sometimes you may find tumors. Tumors are some things that grow in your body in form of cancer. So when you start feeling you are having generally shaky hands every time and you are not nervous, you are normal, you start suspecting these things. Hyperthyroidism, maybe your thyroid hormone levels has gone up and you are having shaky hands and legs and your weight is you are losing weight, always suspect some hyperthyroidism. Parkinson's disease, this is genetic. There are some families that have Parkinsonism. That one, you'll find this person shaking every time and losing weight. You see, causes shaking usually when the hand is at rest. Imagine you are just resting, maybe your hand is here and then it's doing this and you are okay, you're just relaxed. That is the sign of Parkinsonism. Side effect of some medicine like alcohol, certain drugs, and alcohol withdrawals. This one with alcohol withdrawals, everyone knows. Sometimes when people are undergoing alcohol withdrawals, you will see them doing what? Shaking, because alcohol interferes with the nervous system. Neurological problems like epilepsy and some brain injuries, you may find some people shaking. I've said first sign before pain, you get shaky hands, that you are healthy but you are not aware why. Don't ignore it. Look, go find a doctor. Let a doctor find out what is happening. Don't ignore shaky hands. Maybe you might have a problem and it's your sugar levels are going down. And you know, sugar levels kill faster. Sugar levels kill faster. Now, smelling something that is burning, smelling something. Have you ever just walked or sat somewhere and you are feeling something that is burning? Hmm? Have you ever had this? This might be as a result of some nerve problems because when you are smelling, there is a nerve here that is taking signals to from olfactory nerve that is taking signs to your brain. So it may be a sign of infection, cold, or flu that is upcoming. Nasal polyps or some things that grow in your nose that are called nasal polyps. You know, sometimes it's good to 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 stop something early than wait until it has erupted. So when you are smelling something burning always when you are some it comes and goes, go and be assessed your neurological function, especially this nerve called olfactory. Some people have migraines, some people smell strange odors when before during migraines because of nerve problems. You know, migraine sometimes is a neurological problem. When I'm saying neurological problem, I'm saying problems with the brain and the nerves. So migraines, before you feel the migraine, you start smelling something strange that is burning. You should be checked to check. You should do something, a CT scan or MRI, to check what is happening with your brain and the nervous system. Neurological disorders causes like seizures disorders, epilepsy, head injury. Head injury, my friend, is not when you have an accident and then you get a direct injury. No, head injury, there are three types: concussion, contusion, and compression. Concussion is where you've hit yourself but you don't have something that has penetrated to your brain, so you feel the brain has been shaken inside, so you have signs that are showing you have head injury. Contusion is whereby something has beat your head and then it has gone inside. It is causing problems inside. something that has penetrated through your skull. Compression, head injury, is whereby you have something like a tumor or a cancer that is growing inside your brain. So it is compressing against the gyrias, against the matters of the brain. You see, those are neurological problems, and sometimes they present with olfactory signs. Olfactory is smelling. You smell something that is burning, you smell some things that are funny. We are at this, that is the second sign. And then certain brain conditions, that one we have taught, called contusion, concussion, and compression. Exposure to chemicals or smell. Those people that work in heavy chemical companies, the neurotoxins, the toxins may affect your brain, and then you start smelling funny things. You ask always people at, what are you feeling? What I'm feeling? Are you smelling what I'm smelling? The other guys are okay, but you are smelling your own. It is a damage of your neurological function, especially the higher centers of the brain. So don't ignore when you are smelling things that people are not smelling, and they end up with pain. You get it? Dental or mouth infection, gingivitis. I saw in Kenya there is a guy who went to a hospital, a clinic, and then he was extracted a tooth, and then he got something called Ludwig angina. That one kills. Go to a dentist, a specialized one who knows what this person is doing. So when you have Ludwig angina after extraction of your tooth, you swell around your throat, and the gums swell. So when they swell, what happens? You start having rotten parts, and then you start smelling. You see, don't ignore. That is second sign that is very important when you are having these issues of pain and brain injuries. Seeing floaters. You know, when you are just, sometimes you are seated, and you are seeing some things that are floating. You see, it is important you don't ignore teeny black or gray spots. Those ones are, you're not, when I'm saying floaters, someone may be confused. Seeing floaters mean noticing small shaped drifts across your vision. They may not look like, when you're looking at something, you are seeing some things floating around, and they are not in the environment you are in. You are the only one seeing them on your eyes. Floaters. Tiny black or gray spots, strings or threads, cobwebs like, and shoddy shapes. They often move when you move your eye. When you move your eye, you see the floaters. You see, this is a common sign in aging. It's inside the eye, the viscous humor, the liquid part, the viscous humor becomes more liquid with age. So small clumps form cast shadows. You get it? Eye strain or fatigue may cause this. Vicious humor is the part of the eye that has liquid. And then medical causes, posterior vicious detachment, the part that is attached to the side of the eye is detaching. The backward side of the eye is detaching. Yeah, it may be a problem. You need to see an ophthalmologist, a specialist for the eye. Retinal tear or retinal detachment may cause this. Retina, the retina is here in the eye, you're seeing it. Sometimes eye inflammation, eye injury, and diabetes eye disease. You see, diabetes eye disease, you know them. Some people get eye problems when they have diabetes. Those ones are normal. So when you're having headaches and pains, and you're seeing some floaters on your eyes, and other people are not seeing floaters, please don't ignore. And then there is another very funny sign. There is another funny sign that I wanted to talk about: teeth grinding. Teeth grinding. What may this show? And most of the time, teeth grinding comes with neuropathy, comes with a pain called neuropathy. You see, this might be a sign of teeth grinding. By the way, it is called bruxism. Bruxism. If you've ever had someone was diagnosed with bruxism, just know it is teeth grinding. It happens when someone clenches or grinds their teeth, often without realizing. You don't realize that you are grinding your teeth. You are between people and you see someone doing. See, these are the signs that comes before the headaches and some pains. You get it. It occurs during sleep or while awake. You get it. So most of the causes of teeth grinding, when you see someone that is near you doing that teeth grinding, unaware, or sometimes it may be aware, anxiety or stress. This person may be stressed, sleep problems, misaligned teeth or bite problems. This person might be drinking a lot of caffeine and products of caffeine in the stores. I usually tell people, if you want to take good caffeine, go cook coffee or to go to a restaurant, get coffee. High caffeine products are problems. They are problems. Caffeine or stimulants, too much coffee, tea, energy drinks, my friend, they'll give you teeth grinding and neuropathy pains. You see, okay, so you can take, but at your own, you understand. I don't want to destroy. Johnny, be good. Are you good, Johnny, today? Today we are talking about pain and the signs that you should not ignore. Those signs that you feel and you should not ignore in your body. So if you have that sign and you feel, we can discuss. If you have any sign or symptom that you feel you can discuss, drop it and let's talk about it. Please like the video, the topic, and share it to a friend. Jamaican uncle is in the house. I can see him. Please follow Jamaican uncle. He is a healthy, good friend of mine who knows how to live healthy life. Yes, please follow him. You will like his adventures. Please, Johnny Be Good is here. Welcome. Premature gray hair. There is where some people will laugh at me. Premature gray hair. What is premature gray hair? Gray hair. Some children are born with gray hair. I remember I have some gray hair somewhere that I was born with, and I'm still having them till now. But the common problems that occur in premature gray hair mostly are genetics and some vitamin deficiencies. Premature gray hair means turning gray or white earlier than expected. You are 21 years and you have gray hair. It happens when the hair loses melanin. So you see, the dark part that makes us feel dark and beautiful, dark and handsome, yes, is melanin. Melanin protects us from UV rays so that we cannot get some cancers. The pigment gives the color, the color that makes you feel you are the big black stallion. You see, those are the what we are talking about. Now, common causes here are what? Common causes are genetics. Some parents may push that gene to their, there you cannot do anything. You have to embrace it or keep on dyeing your hair if you don't like it. But gray hair is a mark of prosperity and respect. So don't dye it. Embrace it and live it with it. Vitamin D, the deficiency, especially vitamins deficiency, especially vitamin B12, iron. You remember we have just been talking about anemia and we talked about iron, copper and folate. Very important. So if your kid was born with black hair and then this person comes to 15 years, 16 to 20 years, you are seeing this kid, the hair is turning to white at an early age. Hey, this may be a nutritional problem. And you've seen children that has the so-called deficiency problems, the kwashiorkor, the marasmus, their hair turns to brownish. But now white hair is a genetic or deficiency of vitamins in a person's body. Stress, long-term stress makes you age faster. Stress makes you age faster. That's why I love singing. When I love dancing, I love doing my things when I'm happy, and I don't like follow up to check on people's that have other types of social problems. I help where I can and I praise God. So long-term stress is a problem. Don't stress yourself in what you cannot handle. Hmm? If it is not what you can handle, pray to God and let's move on to the next thing. Medical conditions like thyroid disorders, autoimmune disorders, certain nutritional problems like kwashiorkor, marasmus, and vitamin deficiencies, that one we have said. It is a problem. Smoking, smoking. We have smoking again. Smoking. Smoking is not a good thing. Everywhere we touch, there is smoking, there is smoking, there is smoking. So you understand, you show how smoking can cause you have problems with your red blood cells and your problems with other cells like the white blood cells. So we have talked about what? That one, premature gray hair. But there are some people who have scalps that are so itchy. Itchy scalps. What is a scalp? Here, here. As each scalp is a common problem when the skin of the head feels irritated, makes you want to scratch it or remove it. So every time if you do, you are always scratching your scalp. Hey, you just know one, you have dandruffs. That one I don't have to explain. When you go to for men, when you go to shave your hair, you find so many whitish. That is a yeast. A yeast. You need IVs, fluconazole, ketoconazole to wash that head, and you need fluconazole orals to eat, or terbinafine tablets, or there is another one that you can take for 1 month. You see, those ones are the products that you need. It is a problem. Often comes with white flakes. If you do like this, you'll think someone has poured flour. In Kenya, we call it unga. In Swahili, you'll think someone has poured flour on your head. It's not that someone has poured flour on your head. You see, yes, dandruff. You are always having itchy scalps, dry scalp. Here, your scalp is always dry. Happens when the scalp lacks moisture, usually causes it without flakes. That is a sign of dehydration. Dehydration. And then we have another condition of the skin called seborrheic dermatitis. Seborrheic dermatitis, it causes, I'm here listening and making breakfast, cabbage and salt fish with fly dumplings. These dumplings, I think I will test them one day. They are so celebrated. Johnny be good. Enjoy your breakfast. At least the breakfast has got cabbage and some protein, so your day will be energized. Good, good, good. Johnny be good. We are talking about seborrheic dermatitis. Seborrheic dermatitis causes redness. Your scalp is red, oily flakes. When you touch, there is oily flakes, and it is very itchy. Similar to dandruffs. What do you need? You need fluconazole, ketoconazole. Those are antifungals. Yeah, you need them. You need them. Fungal infection like ringworms can cause ringworms, allergic reaction, head lice. Head lice. By the way, do people have lice nowadays? Nowadays, I've seen a lice once in lifetime somewhere. I had gone, but I know of something called in Kenya we call them kunguni. We have seen them once. You may be having them in your house. Skin condition like psoriasis or eczema can affect the scalp. Psoriasis. So when you have itchy scalp, always think of most fungal infection. Go to the doctor. Don't be given symptom relievers and then you say it helped. It will come back with a lot of heaviness. Constant thirst. Constant thirsty. Now, this one I know people know. Constant thirst with more of urination. Constant thirst with more of urination. People know this a lot. Dehydration can cause you to have constant thirst. You don't take enough fluids. Excess sweating, hot weather, and vomiting or diarrhea. when you're vomiting or diarrhea. You can have excess thirsty, eating very salty or spicy foods. Don't be good. You don't have spicy. Yes, we have talked about eating very salty or spicy foods. Those people who love spicy foods, you'll get up to be dehydrated and you'll be constantly having constipation, because dehydration comes with constipation. Salt increases thirst. Use minimal salt that you can to taste. Salt is for taste. Don't overdo it. Exercise. Losing fluid through sweating. There are some people who are overdo exercise. But medical causes, diabetes mellitus, frequent urination, increase in hunger. You understand those problems. Hunger, weight loss. You always have weight loss and fatigue always. Diabetes. You are feeling thirsty every time. Please think of diabetes. Take your sugar levels, follow up to make sure that you don't have the diabetes. There is another one called diabetes insipidus, a rare condition where the body cannot control water balance. Insipidus, starting from antidiuretic hormone, which cannot to your thyroid. You cannot balance the fluids in your body. Please, if you are feeling thirsty every time and it's a problem, please go and see a doctor to know what is a problem. Certain medicine can cause it, mostly diuretics. Diuretics that when you take them, you urinate a lot. Certain medicine. Dry mouth condition. Some people may have dry mouth condition, and it is mostly bringing some problems. You have problems like you have sores around your body. Eyebrow spasm. Have you ever had a problem? This is another sign I'm talking about. We have started with pain, but next from Monday we are going to discuss pain. But these are the signs: eyebrow spasm, eyebrow spasm. Spasm is you're feeling some things. It may be painful, but some not painful again. Some muscle spasms. So you're feeling them on the eyebrows. This one mostly general causes. You may feel fatigue or lack of sleep, stress and anxiety, and we still come back to what? Coffee taking, eye strain. You like watching Netflix, you like watching movies, you like watching the other one is called Showmax. You like watching those programs, you are following a series overnight and you are going to work tomorrow, straining your eyes. You see, dehydration, diarrhea, those ones are normal, but less common is nerve and neurological medication and side effects. But the most common effect when you feel your eyebrows are having spasms, fatigue or lack of sleep, stress or anxiety, caffeine stimulants, eye straining. You have said watching a lot of movie, dehydration or electrolyte imbalance when someone is having some problems like cholera, dysentery, acute problems of the stomachs. You see, those might be the problem. Always tired after sleeping. Hey. Always tired after sleeping. Tell me, is anyone who has always woken up when tired? Imagine, is anyone who has got this sign? You wake up and you feel you are so tired. Let's see, what can be the problem when you wake up when you feel? Let's start with the general ones, like poor sleep quality, waking up frequently, light or fragmented sleep, sleeping in uncomfortable environment. Those are the normal ones. Sleep disorders may be these ones. Sleep apnea, breathing stops during sleep. There are some people who have breathing problem when they are sleeping. They are given even the sleeping bag masks. You see, restless leg syndrome, uncomfortable leg sensation interrupt sleep. These are medical. Insomnia is lack of sleep, trouble of falling asleep. Yes, Uncle said I usually had that problem many years ago. Well, yes. You see, it is something that shows this person has problem with sleeping. But insomnia and sleep apnea, they are friends, because you'll end up waking up every time. Lifestyle factors: excess screen time before bed. You watch television, you follow series, you like watching some series for long. Irregular sleep schedule is very bad. Too much caffeine and alcohol. Alcohol is everywhere. Alcohol and smoking is a problem. We should work on that. We have some medical conditions that may cause you to have this problem, like anemia, which is low blood hemoglobin and energy, low energy. We have seen it. Thyroid problems, hypothyroidism, that may cause you to be tired always. Always you are tired. You should go to the doctor and be looked at the thyroid. It is called thyroid hormone. We have two types. We have the normal thyroid gland, and we have the parathyroid gland. So the parathyroid gland takes care of the calcium, but the normal thyroid takes care of hemostasis, balancing of water, and some things that you should be balancing in your body. You see, yes, we have diabetes. Diabetes, poor, you will always have poor sleep. When it is advanced, you'll have problems like pain causing neuropathy pain. So these are the things that can do you not to have good sleep. Depression or mental health. Depression, please. We started by mental health. Go and look at our notes, our videos at mental health. You will learn a lot about depression and you will sleep well. Now, bitter taste in the mouth. That is another thing. There are some people with bitter taste in the mouth. What is bitter taste in the mouth? What does it do? Bitter taste in your mouth. Bitter taste in your mouth, we start with the general things that come, and then they end up to be so painful. That's why today I've started with a topic that is very general, pain. But I'm talking to things that are signs before I go deep to pain. So, poor oral hygiene, food particles, plague, or gum disease can bring bitter taste. Medications like antibiotics, some antibiotics, when you take them, even when you go to urinate, you feel the smell of the drug in there, and it leaves the bitter taste in your mouth. Acid reflux. Hey, acid reflux for people who have acidity problems and ulcerations in the stomach. This one can bring bitter taste. Dehydration is a very bad thing. It can bring bitter taste. Always dehydrate. And then the devil himself, which is smoking. Smoking brings a very bitter taste after you are used to, and sometimes you are dropping out. You may have this problem, but there is less common in liver or gallbladder problems, because when you have liver and gallbladder problems, you will feel some iron taste in your mouth, iron taste, like metal taste. Infections in the sinus or cold, dental infections, neurological causes. You see, but it's rare, but some neurological causes. When I'm talking about neurological causes, think of the brain and the nervous system. You will have that bitter taste. Restless leg at night. Restless leg at night. Let me smile and say, do you know the meaning of restless leg in some other culture? Some cultures in Africa think of very funny things. When find out for yourself, I will not say it here. Just find out why are some other cultures having, when you talk, that man has restless leg when he's between people. You will find it's a very funny thing. But now we are talking about medical things. Let's talk about the medicine in it. Restless leg at night, tingling, crawling, itchy or aching sensation in the legs, relief when you move or stretching the legs. Symptoms: common causes. One, the most important one. We have moved from the tradition, but I've left, that is an assignment. Please go and find it. I've had some communities and cultures talking about it. Restless leg, iron deficiency. Low iron in the brain can trigger symptoms even if the blood level is normal. You are having twinkling sensation in the legs. Worsen when sitting or lying down. Can cause harm in some affect the arms at some point, or with the iron deficiency. There are genetically sometimes some people have this problem, but we can find some people who have kidney issues, kidney disease, diabetes, peripheral neuropathy, the nerves have a problem, and some medication, antidepressants, antihistamine, you are taking too much cetirizine. And I would advise, this is a very important thing. For if you are a man and you are listening to me, avoid taking steroids. Avoid taking steroids. Steroids make glands to glow faster. A man has something called the prostate gland. And if you take more steroids, the prostate will swell and you'll start fighting benign prostate hypertrophy. Well, but when it comes to hyperplasia, you know it's a cancer. But hypertrophy, it comes to the prostate is swelling and it pushes against the bladder. Now you will start having a full bladder that is not pushing out urine, and then you have a condition called hydronephrosis. After hydronephrosis, you are struggling to kill your kidneys. You get some nephrotic syndrome, and then your kidneys, you start dialysis. So men, please, steroids, no. Antipsychotics can cause these problems, restless legs, pregnancy, often temporarily, usually the third trimester. So I've talked to the men about steroids. Always use cetirizine, not the dexamethasone, not you can use them acutely, not for long. You get it. You get it when it's needed. Antidepressants. No, we have talked about the restless syndrome, and after talking about it, I've left you with an assignment to find about the culture. Here we talk about medicine. Sudden night sweats. Sudden night sweats. You get that sudden night sweats. Sometimes you can be sleeping. Let me, has anyone in the group have ever got something called sleep paralysis? Do you know what sleep paralysis is? If you are listening and you have ever got sleep paralysis, please tell me. Sudden night sweats. Night sweats. If you have ever had sleep paralysis, please raise your hand. It's a very traumatizing event. Sleep paralysis. Please raise your hand if you are open and you can talk about it. I once got it when I was a kid. It was a traumatizing event. So sudden night sweat is it shows some hormonal imbalance. This one comes often when someone is at puberty or menstruation, or the people who go to menopause, when your hormones are transitioning. Pregnancy, this is something that comes when you sleep. So they're different from sweating due to a hot room. It is different from sweating when there is a hot room or the sun is so hot or you are exercising. But this one, you're just sleeping, you're just seated, and you're feeling night sweats. You get it? Infections like flu, bacterial infections like TB. The first sign of infection when a person is TB positive is high what? Is high sweating at night. Because as you sleep, most of your as you sleep, the body is still working on the bacteria. So TB, you have night sweats and coughs that are coming and going. Please visit the doctor. You'll be screened to be given some medication. So some medications like fever-reducing drugs, antidepressants, steroids, diabetes medication also, they may cause this problem, but not so much. Stress or anxiety, you remember, that one can cause. More serious causes of sweating at night. What are the more serious causes of sweating at night? Endocrine disorders. Gland. The gland disorders like the hyperthyroidism and low blood sugar levels. This one can be a problem. And some cancers, lymphomas, Cancers can bring you to sweat at night. Neurological or chronic diseases like heart disease and some infection. When you are sweating at night and feeling so hot at night, the first thing you should think of is infection. Think of viral or bacterial infection. That is the first thing you must think of, because the body is undergoing inflammation and it wants to help you to fight the disease. And you see, when we talked about when it comes to inflammation, what happens? Hotness comes. So this is an overview of what we are going to learn about pain. And then we have another thing that is called ear pulsation. Have you ever had your ear pulsating? Ear pulsation. Talk of ear pulsation. What is the problem when it comes to ear pulsation? What happens? Often benign. Wait, I'll finish, I come. Often benign. You get it? Often benign. I'm needed somewhere, but we have to finish this today. We have to finish this today, and we have to get to know what to do. They don't interrupt me. It is very important for this. Often benign, increased blood flow, exercise, fever, anxiety can make you more blood to flow in the ear. Because now when you are exercising, you are at the gym working out, carrying the dumbbells, or someone has you are anxious, or someone has just made you to your blood to go faster. What is released? Adrenaline. Adrenaline is a hormone of fright or fight. When adrenaline is released to your system, you can either run away or you can fight back. It is a hormone that is preparing you for those two, and it increases blood flow in your ears. So you can hear the ear pulsation. You can see these are common causes. And sometimes your ears can build up wax and you are not removing it. Please check the ENT person, let that person do a good job. Ear, middle ear. We have inner ear, middle ear, and the outer ear. The middle ear might have problems like infection. So medical causes that can cause those ones are general things. The flight, adrenaline, and so forth are general things. Now let's talk about the medical part now. The medical part. Now this is the professional part. Blood pressure rising. You can hear ear pulsation because the veins and the arteries that supply the ear, they are having a lot of pressure. So you can hear ear pulsation. Vascular abnormalities. Some narrowed or bulging blood vessels near the ear. Here, you should be screened by an ENT, ear, nose, and teeth specialist to check at you and know what is the problem. Temporomandibular joint disorder. Temporomandibular joint disorder creating pulsative signs. Here, there is a joint, temporomandibular. This is the mandible. Then we got the temporal bone here, the skull. Now, those skulls are like this. So when they have a problem on articulating. Articulating is lying against each other. Articulating, you may have the problem by feeling it on the ear bulging. Yes, King Ray, J. King Ray in the house, a beautiful lady that does so wonderful work. And you should look at J. King Ray's work at her YouTube channel, and you live there while you are smiling and smiling. She likes smiling. Please go to J. Kringle's channel, like and smile as she smiles back. Good. Let's continue with bulging ears. Bulging ears like tumors, rare. Some tumors in your brain that comes around the temporal bone may cause your ear to to bulge, to bulge. Yes, yes, yes. We have talked about it, and then we've. Have you ever had a craving for ice? Hmm? Those people that have a craving for ice, you just around and you're feeling today, I want to take ice. You go to the hypermarket, you take ice, you finish, you send your child, or you sneak out if you are in your house and your parents are there, you go buy another ice. My friend, ask yourself, is this normal? No, it's not normal. Craving for ice is called pagophagia. Pagophagia is not normal. You see, it's not normal. Actually forms a pica. Pica is craving or eating non-food items. You start by ice, you finish by some stones. While it may seem strange, it can be sign of underlying health problem. Let's get to know what is these problems. King Ray, let me give you thumbs up. I'm here. Greetings. I've said greetings. Now, the common problems with pagophagia, which is craving for ice, the people who sneak out to fridge at night to take some ice and feel they're good, and then it's not even finished, you go and pick another one. First, iron deficiency is most common. Iron. People who have no iron, we have pica. Pica means craving for very many things, like you start eating clay when you pass somewhere where there is a hot thing that is burning sand, you feel eating the sand that is burned or the stones that are burned. Nutritional deficiencies. So the first one was iron. This one is nutritional deficiency, like zinc. Zinc may sometimes cause cravings of food items. So you take your zinc supplement, don't go to crave for ice, because more ice may bring a problem, and maybe you are diabetic, you have hyper sugar levels go up. You see, it's not good. Go find a doctor, let that doctor define what is the problem. Yeah, we have stress and anxiety. Some people who are stressed can eat a lot of ice, and the picker can come in, and they can eat more food. And when you have stress and anxiety, habit is a problem. That condition should be corrected. You see, we have said the several things, and now we are about to finish. Please, if you have not liked the video and shared it to your person who likes speaker, if you have a friend who loves to eat ice cream every time, share that person this video. Yes, yes, yes. And he said, I just like ice cream. Your girlfriend, I just like ice cream. That is my weakness. No, it's not your weakness, it's a problem. Now, night cramps, night cramps, night cramps, night cramping. Night cramping. What is night cramping? Cramping of your muscles, cramping of what? Usually refers to muscles cramps that occur at night. Muscles cramping that occur at night, often in the calves, the feet, and the thighs. These are sudden, painful, involuntary. They are painful. You have not caused them. They come by themselves. We have voluntary, like if I want to take this bottle of sanitizer, that is voluntary because I've taken it. But involuntary, you find my head is not thinking of picking it, and it has already picked it. Eh, some thieves tell us they are involuntary thieves. You are found with something you have stolen, and then you say, I'm just an involuntary thief. It's a problem. Please help me. My friend, we will help you by giving you a sentence for life. Now, we continue. These ones can be involuntary muscle cramping. Common causes are dehydration, not drinking enough water, and muscle like cramping. Electrolytes imbalance. Your body has no sodium, the potassiums are high. Those ones are the electrolytes that are balanced by your kidney. And this one may be a problem of the kidney, electrolyte imbalance, muscle fatigue and overuse, Poor blood flow is a problem when it comes to muscle cramping. Johnny Be Good, send me wa P day. Send me wa P a day. That's all missing, just waiting for the planting to finish fry. Hey, Johnny Be Good, you want that? Someone send that to Johnny Be Good. Johnny Be Good is craving for avocado. Oh, there is someone in Jamaica, a lady who have sung a song called Avocado. I have a little juve named Orlando. He lived over west over, so I will sing that song another day. Let's continue with our topic. Our topic, we are talking about the lady is called Janine. Please find that song. Johnny Be Good, listen to that song by Janine. Poor blood flow. And then we have medications like diuretics, statins. Statins are medications that bring down cholesterol. They may give you this problem of cramping of your muscles, and other drugs like antidepressants sometimes. We are some causes may be like nerve disorders, endocrine problems, and pregnancies. Those ones are less common when you have cramping off. And you see, these are things, when I start talking about pain in details as we continue, it's just an introduction of some things that you may face. You may find these things I'm talking about, they are in any other pain that is related. Yes, peeling of the nails, peeling of the nails. Your nails, tell me, are your nails just okay or they peel sometime? This is a sign of several things, and it's a sign which we should take very important. Please, I'm about to finish. I have 3 minutes. So if you have a question, I'm waiting for it. I have 3 minutes. If you have a question, please wait. Tell me if you have a question. Like, I have some 3 minutes or 5 minutes. Now, peeling of the nail, onychomediasis. It is called onychomediasis. Onychomediasis, or nail layer separation, happens when the top layer of the nail starts flaking, splitting, or coming off. It may be temporary or a sign of underlying problem. Most of the problems may be trauma, biting your nails always because of being anxious, or frequent nailing feeling. You feel the nails with artificial nails, or injured nail beds. Nail beds are below here, injured. Frequent wetting or chemicals. Lowering exposure to water, washing dishes, and you see sometimes it's a hassle. Some people are working hard in their hotels, it's normal. We should take the measures that are supposed to be taken. Nail polish, acrylic nails, or harsh detergents. Nutritional deficiency. When you have some deficiencies and your nails are peeling, what are these deficiencies? Biotin, protein, zinc, iron affect nail strength. So make sure you take foods that are good in biotin and protein, zinc, and iron. Aging. When you age, your nails become soft and can peel off anytime. Medical causes. We can find fungal infection, skin conditions, as systemic conditions like thyroid disorders. This might be the problem. Psoriasis or eczema affects the nail. Psoriasis and eczema. Yes. Now, we have talked a lot, and it's about like 1 hour. I have 2 minutes. No one has asked a question, which is very okay. If you have a question, you will bring it. But today, we have learned about, there is one assignment: restless legs. Find some communities what they think about the restless legs. And then we go and listen to that song by Janine Avocado. That Johnny Be Good is wanting avocado to his breakfast. Yes. Thank you so much to be on my channel, and your support, your likes, your shares, and everything. We grow together and we continue with the show next time. Be blessed. Or is there anyone with any question? Pain will continue. The topic about pain will continue next week. If we have some time on Sunday, for those who are going to church, go to church, and we pray God. So next week we'll continue the topic of pain. We've just started by signs that you should not ignore when you have several pains. So on Monday or tomorrow, we'll talk about pain itself and several pain. Be blessed, everyone, wherever you are. Like and share the video as we continue. Today we have no questions. People are good, good, good. Be blessed, everyone, and thanks for tuning in. Benjamin, the wise guy.